Today's episode of Socially Democratic is presented to you by Dunn. Over the course of this global crisis in which various forms of isolation has become the new norm, it's critical that we organise to overcome these challenges, and Dunn has partnered with organisations across Australia and the globe to train leaders, develop engagement strategies and empower people to organise in their communities. And in 2020, Dunn will continue to work with those folks and others to make a difference, inspire, give hope and build communities from the ground up. And to find out how you can partner with Dunn, hit us up at dunnstreet.com.au. Hello, my name is Stephen Donnelly and welcome to another episode of Socially Democratic, your favourite number one weekly centre-left political and cultural podcast that dives into the progressive issues of the day and the people leading them from both home and abroad. We took a couple of weeks off there, just got a little busy. Needed a break, that kind of stuff. But we're back. We've got a whole heap of episodes lined up. Very excited about that. And in fact, on today's episode, we are speaking to a clinical psychologist, Dr. Michelle Lim from the Swinburne University in Melbourne. And she specialises in social isolation, risk and loneliness. And she's on the episode today to talk about that. And obviously, because coronavirus has all the restrictions placed upon our society because of coronavirus and the pandemic, people are going to be feeling lonely. So we thought we'd get Michelle on to come and have a chat about that and some of the work that she is doing. And she's actually doing a really, really important study at the moment. And in the bio for the podcast on your podcast app, there is a link to the work that she's doing. And you should go check that out as well. Really important stuff. Speaking of the bio and the link and all that kind of stuff, don't forget to subscribe to the podcast on Apple Podcasts, Spotify, Stitcher, SoundCloud, and your favourite podcast app. And if you are on Apple Podcasts, don't forget to leave us a rating and a review. And obviously, as always, follow us on all the various social media platforms. Dunn on Facebook, Dunn on Twitter, Dunn on Instagram, and Dunn on LinkedIn. And another thing, the final thing before we go to today's episode, Dunn and Socially Democratic are working in conjunction with La Trobe University's Arts Humanities Department, particularly in their media and communications section. I should know the name of it, given that I went to La Trobe University myself. But we have got an internship program and we're providing opportunities for students who are studying media and communications to get some first-hand experience in producing a podcast. And so we began this program with La Trobe at the start of this year, start of this semester, and this is our very first episode that's been produced by one of the students. So I'd like to thank Pamela Kirakides for her great work in producing this episode from go to woe, or from woe to go, whichever way that goes. So great work, very talented young woman, and she's done a great job with this episode, as she will do with the rest of the episodes for the rest of the semester. No pressure, Pam. But let's get to today's episode. We're taping this one on a Friday morning in downtown Melbourne, and on the line is the Senior Lecturer in Clinical Psychology, Dr. Michelle Lim. Welcome to Socially Democratic.
Thank you for having me, Stephen.
Now, as I said before, you're a Senior Lecturer in Clinical Psychology and lead the Social Health Wellbeing Laboratory at Swinburne University here in Melbourne. Just a bit of background on yourself. And how you got into psychology. Can you pinpoint a moment as a young person that influenced you to pursue a career in this field?
I could think of many moments. I think probably the most pivotal is meeting a very influential psychologist, an American psychologist, when I was younger. And I thought that he was eloquent, he was sensible. He really kind of spoke about understanding or trying to really understand the kind of more silent processes around how people interact. And that actually pivoted me towards, really trying to think about what career path I wanted, and actually meeting those kinds of role models seemed to be very important for many young people. And it it didn't dawn on me though that it was a very difficult pathway that I did choose, because if you choose, everyone pretty much wants to do psychology when they were younger, and realizing the breadth of knowledge that you do have to be good at, not just in reading people, understanding those nuances, but also statistical analyses and all the academic rigor that goes along with it. So it's a little bit of a learning curve, and you almost have to be good at all aspects, really, especially when you are a researcher in this field.
You just said an interesting sentence there that just jogged in my memory as a high school student. You said, when I was younger, everybody wanted to do psychology. That's true. I forgot about that. There was a period there where, and I don't know if that's still the case, but everyone wanted to do psychology. Why was that? Or why is that?
That's a very, very good point. And I remember as well being a first year university student at Melbourne University. And I remember, everyone was enrolled in Psychology 101, and there were like multiple classes of, lectures that they had to actually put up. And, in each lecture, we had thousands of people. And I remember there was this, I can't actually remember which lecturer it was, but he basically said, how many of you would like to be psychologists? And everyone puts up their hand and said, well, okay, so maybe 10 of you might make it to the program. And it was really interesting. I had the same feedback from my GP very recently. She said, you're a psychologist, I really wanted to go down that path, but I just thought it was too difficult. So I ended up in medical school, which I thought was a little bit ironic. I was like, oh, really? Medical school is easier to get into psychology? She's like, yeah, absolutely. And I decided to go down the medical route because I didn't have to go through this calling process, as we put it. We're basically making you jump hoops to kind of make, so that you can actually proceed to the next steps. So it's been a little bit of a learning curve. So I think most people don't realize that, we have to jump through all that training, and we should, because really, psychology is one of those professions that really have to be an ethical and responsible professions, because we are taking care of the most vulnerable in our society. So I understand this need to basically develop very stringent and rigorous training programs.
I had a very similar experience in first year uni as well, in the archaeology class that I took, and the lecturer, and it was packed. It was at La Trobe University in the Agora Theatre, and I remember the lecturer said, now, if anyone is in here because they think archaeology is about Indiana Jones and chasing Nazis and whips and riding off the back of cars, leave now. So I got up and left.
I guess everyone has this, idealistic view of what archaeologists is, or whatever those professions are. But really, I spent most of my early years, roughing it out really in the public mental health system. It's very difficult because you're working with very vulnerable people in our population that are socially and economically disadvantaged, and there's actually no glamour in working as a psychologist in those fields, and you really do the best you can with the resources that you have.
How did you find it when you first came out of university and started, practicing in your field? What were the things that challenged you that weren't raised in the academic part of your studies?
Look, I think I would dare say that most psychologists and many psychologists come out really from a background that's probably a little bit more affluent than the people that we work with. And I think, being kind of thrown into the depths of people who are socially and economically disadvantaged, and really understanding from their point of view, when you actually have to work with those circumstances or work with a client or a patient in those circumstances, was a steep learning curve for me. But it was also one that I think every psychologist needs to do. Like there's this idealistic view of, we can kind of really just cater to people who can pay, to see a psychologist. But really, I think the best training is really to work with the most vulnerable and actually understand. And if you can understand those barriers that they go through, I've been in houses in which, I would have to basically wash my shoes after. For
Mm.
example, in the most deprived areas of Melbourne, people don't understand until you've actually worked with that group of how much need there is to assist. And I think that's a really steep learning curve for most psychologists, including myself. But it's also one that I think is really absolutely needed, because you don't really know, and people can get very, very almost distant if they are not actually experiencing it, or with their clients, or assisting clients, or and understanding their situation. And we work very intensive with that group where we're in their house, so we don't actually they are not able to come to the clinic. We have to go out to them because they are that disabled. They are perhaps experiencing deep levels of acute psychosis sometimes, that those things. And in sometimes we do feel, potentially we have to go in groups as well, just to kind of keep our staff safe. But I think, understanding that acute end, the chronic end, not just people who are able to come to the clinic, that's really crucial for psychologists.
Your specific area of academic study is centered around loneliness and how it can negatively impact on social functioning. What drew you into this particular area of study?
That's a very, very, very good question, because actually it came out of my clinical training. So I was working, as I mentioned, with people who were very socially disadvantaged and who didn't have anyone other than the mental health service people who would visit them. And what I did find was that, and I did my PhD training as well at this particular public mental health service and at the University of Melbourne. And what I did find was that even though this particular group had people coming to them and constantly in and out of their house, sometimes we see people every day, they felt lonely. Despite the level of social connection, social support, and including financial support and housing support, things that case managers, for example, would provide, it really didn't matter, because they didn't have the relationships that they really needed, which is reciprocated relationships with their peers, where they also felt like a valued member in that relationship. If you're constantly receiving services, you really start to feel like a burden. You don't have any self-esteem. And what we noticed, and especially in my particular PhD, we did find that, people who were experiencing psychosis, for example, their distress with their psychotic symptoms were moderated only when they reported that they had these social ties that were reciprocated, so that were meaningful. So it's not just them asking someone for help, but that person or their friend would also ask them for help and making them feel valued. So this idea that just because you have ties or just because you have people visiting you doesn't mean that you're going to be less lonely. It's really about the meaningfulness of those relationships that's more important. So a lot of these programs would, for example, advocate that they reduce social isolation and loneliness. And I really would like to see some data evaluation around that, because I think most of them would say, I would agree that they would reduce social isolation, but would they reduce loneliness? I do not know. So those are two different things.
That's interesting you point that out. I think about that from in my day-to-day occupation in organizing, and it's important when building capacity or building power amongst people that there is when we build relationships, it's based on not a transaction, as in if I give you this, you'll give me that, but it's actually based on a mutual commitment to each other to work together to share each other's resources. And I could completely understand if you were someone who was in that situation where you are lonely and you have become dependent on something that is not a meaningful relationship. So
that's right.
And so tell me more about this. You've identified this and you've done your PhD, and then extrapolate how you've started to work around this in this field.
So I was very lucky to actually get offered a postdoctoral research fellow at Washington University in St. Louis. And that's actually just south of Chicago, where a lot of the social neuroscience research in loneliness come from. So Professor Cassiopoulos' work. And I was actually working in a social anxiety lab. And I was trying to really understand what's the difference between paranoia, in which it was a field that I was studying quite a bit in my PhD. What's the similarities between paranoia and social anxiety? So both really concern people. One is about the fear of others and fear of being negatively evaluated. So that's social anxiety. And then paranoia is really a fear of persecution, fear of being targeted, or fear of being talked about. And I really thought this idea of, there must be some overlap. And what I really stumbled into is actually measuring loneliness. So how lonely are these people? And does loneliness actually predict more severe mental health issues? And ironically, that was probably back in, I think, 2015. It sounds really strange, but even though loneliness is not a new condition, traditionally it's not actually been examined. It's really social isolation, as I mentioned before, it's been much more scrutinized. And really the only few what we call longitudinal studies that have been done is Professor Cassiopoulos' work, where he looked at older adults, where he measured older adults in, I think it's a Chicago aging study, across 5 years. And he found that loneliness predicted depression, but depression didn't predict loneliness. So they're distinct constructs, which people get confused all the time. And so what I really wanted to do is to say, right, okay, so what's going on in other ages? We really need to extend this understanding of across this community, what's going on in the community. And also, what about all the other mental health symptoms? We have, social anxiety, we have non-clinical paranoia levels that people express all the time. And of course, depression, but we don't really know what those predictive relationships are if we do actually monitor people over time. And I say this, but a lot of studies will only measure these relationships at one time point. It doesn't really tell us anything about what actually drives loneliness. And so when I did this study at WashU, we looked at 1,010 Americans across 6 months, and we modeled that data. And interestingly, as expected in terms of the hypotheses that we have, loneliness predicted more problematic depression, more problematic social anxiety, more problematic paranoia across a 6-month period. So basically, if you were lonely at the first time point, you're more likely to be actually expressing all this poor mental health in 6 months. But what was really interesting was that if you were also socially anxious, you were then also more likely to be lonely. So what that tells us is basically with loneliness types of solutions or interventions is that if someone's already experiencing a high level of social anxiety, they fear meeting people, they have a fear of being judged, they have a fear of saying something silly to humiliate themselves, getting them into the group is, first of all, is going to be very difficult. But if you don't address the social anxiety, it's not really much of a point. So it's really important, even in a non-clinical level, that we don't dismiss, just go you're lonely, just go join a group. That's great for some people, but if you have this level of social anxiety, even if it's a non-clinical level, it's going to impede your progress. So that kind of methodology is so important in really understanding what drives loneliness, and people don't do that. We go with what we think makes sense, which is, let's join a group, or let's do a shared interest group, or let's try to get more friends. But those are logical. Those are very logical options, but they don't work for everyone. So I think it's really important that we really build on that kind of research so that we can really inform what drives loneliness. And the truth of the matter is, it's probably more than social anxiety. It's a wide range of other things. What the level of impact it influences is, we don't know it. We don't know, and we need to study. So is it your living environment? Is it your access to money? All these logical things that would influence the way we interact with people and how we interact with people. All those things are important. And we really are just scratching the surface and really understanding what causes loneliness, because there are several levels that we can look at, from all the way from the individual, their personality, all the way to policies. So it extends across different phases.
Well, the reason why we were very keen to get you on the podcast today, obviously, was to talk about this particular area of study and mental health in relation to what is happening right now and is on the front page of our papers all across the world, and that is coronavirus. But before we sort of dive into the impacts that coronavirus are having on our community, I actually just want to get a sense from you. And I've asked all of my guests since this pandemic first began, when was the moment when you first realized that this was going to have serious implications on Australian society? When did you realize that this coronavirus was going to be, oh shit, this is quite significant. We possibly should be paying attention to this.
I think very early on, I was very well aware of the infectious outbreaks, for example, like things like the SARS and Ebola, and the impact of those things. And what I think is surprised me, and probably surprised most people, is that it really the impact of COVID, really highlights not just socioeconomic inequalities, but also that we are so interweaved, like we're so part of a social fabric that we didn't actually realize that, and it's this economic, I guess, stress on workers, for example. At the moment, we expect, as psychologists, a second wave of mental health problems to come, and those things are very much linked, and that would be my worry, really, for as a mental health researcher, and understanding how we can mitigate those effects while trying to balance the public health crisis at the same time, because those social restrictions that we're going through are indeed necessary to prevent outbreaks, but having to weigh that out with the mental health implications down the line. And we don't really know the depth of impact until probably from years to come, right? So we're really, what we're doing now as researchers is just projecting and understanding just this phase. But we would expect, those economic losses and downturn, and not just a country, recession, a global recession. Those sorts of things will have impact for many years to come. So as psychologists, I think it's really important for us to think about, people who have not ever had mental health issues will actually start becoming more unwell, and quality of life will be going down. And I don't know anyone, Stephen, that's whose life hasn't been impacted on COVID. Everyone has, in every single level. If you haven't lost your job now, you're probably going to lose your job at some point, right? Or you're going to have a reduction in your pay at some point. I haven't met anyone who hasn't had that situation, or that personal impact.
The question I want to ask you now, I just realized that when I think about it, is actually so wide scoping that you could spend probably a whole year just answering. So let's maybe try not to do that. But I mean, how does the pandemic create conditions that impact on people's mental health, and in what ways?
So look, I think that first of all, if we go back to kind of some of the social theories, is that we actually rely on other people to thrive and flourish. We rely on not just our partners or people that we know. We rely on the wider community to kind of either regulate our own emotions, make decisions. So actually, when we have that restricted access, it really changes our behaviors, and if it actually propels us to kind of be more in our mind, and no one actually is able to kind of almost kind of pull us out of those negative thoughts. That's can actually be very detrimental. On top of that, there's additive effects, or real life effects in that sense of job losses, being more constrained, not knowing when you are able to feed your family or pay your mortgage, and having to lose your assets is actually incredibly stressful for many people, and also those who might actually know someone who's ill or vulnerable or have fallen ill from COVID. That is another added stress. So, I think we can't discount the multiple factors of the things that would predict poor mental health. It's not just poor mental health to begin with. It's all this other stuff that will add on to it. And also how this crisis is going to be managed in a longer term. So I know we've kind of put some plans in for the next 6 months, but post that, we don't know. A lot of these things are not within our control. We did not have a say around social restrictions, for example. We were just told very immediately, this is what you've got to do to save lives. And I have to say that there was a little bit when I was first giving lots of interviews at the start, there was a lot more people being very upset. And now what you see is that people have kind of adapted and changed their behavior and almost kind of habituate a little bit to the stress. And every time we have a change, it's, people have to adjust again. And humans, we like routine. We don't really like change all that much. So it's this idea of having to be adaptable and flexible every time we hear new public health guidelines, in which, of course, we should, but it will be harder for some groups and not others.
Considering your work focuses on loneliness and how it negatively impacts on people's social functioning, the pandemic and the stay-at-home orders have obviously created this huge national-wide sample for you to study. How are you able yourself, because you're in social isolation, are you able to perform that study right now, or do you have to wait until these restrictions are lifted, or are you able to right now be able to use this moment to help your research?
Look, I think good question again. Luckily for us, even pre-COVID, we have done quite a few large-scale studies about understanding the level of loneliness and what we call social isolation risk, which is the degree of contact you actually have with someone pre-COVID. So we've had a database already established. What we're trying to do now is to follow up the same database, but also we have now conducted together with some international collaborators a global study, really looking at the impact of social restrictions on our loneliness, on the way we interact with each other, on our physical health, on mental health, and our quality of life. And we are studying these guys over the period of 6 months. So what we would expect, though, is that obviously country to country, all levels of restrictions are different, even state to state, as you know. Victoria is a very different state to Queensland, for example. We need to understand what level of social restrictions each location is undergoing and actually understand the influences on loneliness. What I can say, just kind of eyeballing the data, we are closing what we call the first phase of surveys. That is not so much about whether you live alone or not, and whether you're more, because you live alone, you're more lonely. It's actually more around who you live with. So if you're living with family or someone, a significant other, it tends to buffer your effects of loneliness. This is just based on partial data, just to note. And in a very kind of crude sense, if we're looking at just a cross-sectional data. But those who are living alone or those who are living with non-family members, they appear to be fairly equally lonely. So it really speaks about not about the number of people you live with, but who you're living with, and whether these people that you're living with, you feel like you have some sort of meaningful relationship with.
Rightio. So it really impacts if you've got really shit housemates, then that's going to lead to loneliness. Then good to note. Good to note.
Yes. I actually, just on that point, I always give the example of one of my teammates who lived with 8 housemates, and she fell and hit her head in the bathroom, and she wasn't found until 2 days later. So, if you're living with 8 housemates and no one checks on you, and she actually ended up in hospital with hypothermia because she wasn't found until 48 hours later. So do you see what I'm saying? It's this idea, it's really about the relationships that you have in that household as opposed to the number of people that you live with.
That's horrific. Oh God. So actually, here's a question for you that I actually wanted to ask that I hadn't considered. How do you conduct the research into this? Do you have specific people that you study? Is it through survey work? And how do you monitor that?
In a very at this stage in COVID, we really are reliant on either phone interviews or online self-report interviews, which we've found to be quite equivalent to some of the face-to-face modes of data collection. In this case, what we'll be really interested in is the general population. Doesn't matter if you have a disability or your carer or parent. We account for those things and we partial out any kind of potential effects. So we will measure as much as possible what we think is a confounding variable, or a variable that might influence loneliness. So that's more important. And really what I'm interested in is really the wide spectrum across the population. At the moment, we're a little bit restricted because we are unable to access under 18. And that's really an important, adolescents and children are actually part of our society. We should actually be measuring these guys, but because of the nature of getting parental consent, we have to we don't know if who's consenting on these studies are actually someone that's over 18. So we really just restrict that to people over 18 only at the moment. But it's really important for us to really extend our research post-COVID to really understand how it impacts on younger generations.
And then from your studies, when you start to look at solutions to loneliness, and as you said, look, you mentioned before about how many people have lost their job because of the pandemic and are experiencing sort of inconsistencies in and lack of routine, as you put it. How can people who are out of those routines and are maybe experiencing negative feelings and stress, how can they be mindful of this? What do you recommend? You're the doctor. Tell us how do we get out of this rut?
I'll have to put my clinical psychologist hat on instead of a researcher hat. So I think our best guess is really, when it comes to things like worry, I think really assessing what is it that you have a level of control over and what you don't. And I often say this to clients that I do see is that if you know that worrying actually helps you get somewhere, then that by all means go ahead and worry about it. So for example, a typical example pre-COVID is that, if I had to go to work and I started to worry a little bit about trying to beat traffic, and I actually got myself into the car early because I was worrying about it, then that's what I call productive worry. But there's stuff that, I might be worrying about that absolutely I have very little influence about. Say, for example, if someone really likes me or not. No, I could be nice and I could do all the right things, but they just don't like me because my name is Michelle, and they associate that name as someone they don't like. Yeah. There's really nothing I can do about it. So really assessing what is it that you can control, what is it that you can't control, and the stuff that you can't control is put it on a piece of paper and actually park it. Because they are all valid concerns, and they are also concerns that many people have. Whether I have a job or not, this is really the same concerns that I would have as well. But because there's nothing you can do about it right now, you have to park it and actually focus on the things you can control. What are even if it's minor things that you can control to make your life that little bit easier just for the day? And are you too hard on yourself for trying to achieve what you need to achieve during this time? Those are really questions to kind of take a step back and actually go reflect, what is actually achievable during this time.
Yep. Are there simple activities that people can or should consider if they are feeling lonely at this point in time?
Look, I think what's really important is I think going back one step is I think a lot of people don't realize when they feel lonely. I think the word lonely comes with a lot of negative connotations. But I think first thing is to really, if you do feel that way, even if you don't, reach out to other people, I think the first thing is to really tell yourself it's actually very much okay to feel this way. You're very much normal. And I think most people should be seeing loneliness as a regular human need. This is how we thrive and we flourish as a species. We needed groups and we needed other people to function, and we needed those meaningful relationships to be the best we can. And if we feel like our relationships are not really meeting those needs and we feel lonely, first of all, That's very normal, and that's a very what I call regular signal for you to do something different. So see it as not so much that there's something wrong with you, but more that there's something that you need to change. And then think about what you can change, because making a new friend is completely unreachable for many people. Especially when you get older, making new friends is hard. When you're younger and you're kind of embedded within the school system, making new friends is a little bit easier because your access is a little bit better. But for many people post that stage, trying to make a new friend is a little bit trickier. So if you can't make a new friend, can you change an acquaintance into a friend, or can you make a friend a better friend? Actually make that meaningful relationship that increases the quality of that relationship that you have with someone. And it doesn't even have to be a friend. It can be a parent, it can be a sibling, it can be someone that you already know that you're comfortable with, but really just building that depth of relationship into and putting in the effort, because we all know that everything takes a little bit of time and effort. You don't need to spend money to do those things. It's always about making that little effort over a period of time, as opposed to these big gestures where you're throwing expensive parties to make friends. Like, that's not what we're asking you to do. Is really making those little steps achievable long term, and something we chip away as we progress through life. And if you have lost friends, it's actually okay, because again, that is a regular dynamic that we all go through, right? So friends come in and out of our lives for different reasons, because they are at different phases, and sometimes it's not about you. So if you have lost a friend and you feel upset about it, you feel lonely, I think what's really important is to understand that there will be many friendships lost in your life, but also many friendships gained. So if we spend a lot of time kind of thinking about the friendships lost, we're actually losing that time to gain those new friendships and those new ties that could potentially be really beneficial for you.
So we have all of these organisations out there that do good work beyond Blue, Lifeline. How does the academia world partner with those types of organisations? How is that manifested? Like, how do you take your research and provide it to this, I guess you'd call this industry, to then go out there and do good work in actually working with people in the community?
That's a very good question. It was actually a gap that I identified around 2016, and we started this organization called the Australian Coalition to End Loneliness, and now rebranded to Ending Loneliness Together. And basically, the objective of this particular organization is to really try to form a relationship between industry and science, because what I noticed was there's a massive gap in understanding what the scientists are saying and what people are rolling out, and trying to kind of reduce that discrepancy between what people are delivering and what scientists we see as more rigorous and more effective. And if we can actually channel some of that information in a way that's digestible to industry, and actually getting them to also improve the way they deliver programs, I think that would be amazing. So things like, how do they know someone is actually not just less socially isolated, but also less lonely? How do they know if their programs work? How do they know what the cost effectiveness of those programs are? And also the training that comes with implementing those program evaluation. There's a massive gap and difference between how scientists would do an evaluation as opposed to industry. And it's not saying that it's wrong, it's just two different ways. And what, as scientists, we want to do is to always make sure that if we do say a program is effective, it is effective, and that more investment really needs to go to those kinds of programs. So Ending Loneliness Together really is an organization that's trying to bridge that gap, and to have almost a joint national focus on trying to get everyone kind of to do the same thing as a joint effort, so that we can kind of make a difference.
There's a number of very influential people in government that listen to this podcast. So here's your chance to pitch for some funding. but in all seriousness, where does your area of research require support from? Where can government? Sorry, let me rephrase that. Where can government play an important role in supporting the work that you guys do?
Look, I think Ending Loneliness Together hopes to be the peak body for anything loneliness. So we need a coordinated national approach to tackling loneliness. Loneliness doesn't fall into anyone's particular portfolio. Loneliness is everyone's business, right? It affects every part of the economy and people. So it's a large area that needs coordination, and it needs multi-partisan support. Everyone's got to learn to work together and try to do a little bit and be more coordinated to actually really reduce loneliness. And I know we call ourselves Ending Loneliness Together. What we're really trying to do is actually get people to manage loneliness better, so that it doesn't actually lead to more physical health problems, earlier mortality, poorer mental health, affect workplace productivity, and cost businesses. So it's more of a coordinated approach and an investment into a peak body that can really lead the way in terms of a national effort and pull everybody from every state to actually try to follow certain guidelines, whether it's evaluating their programs or reporting back about how they're going, and even training. How do we actually train clinicians as well to reduce loneliness and not just reduce social isolation? There's so many things that we can do, but it definitely needs significant government support.
I'm wondering about as we sort of move through this pandemic and hopefully come out the other side of it, that we see changes to society and how we behave, how we interact with each other. Like I'd like to think, certainly from an employer standpoint and a work-life balance, that as we come out of this crisis, that employers may be a little bit more open to the idea of allowing workers to work from home and maybe don't force their staff to hop on the red eye to Sydney for a meeting that goes for 20 minutes to then fly back to Melbourne, where they could have just done it on Zoom or Teams or something, those kind of things, right? From your standpoint, what are you hoping to see come out of this that can hopefully mean that there is a positive social impact born out of what has been a terrible crisis?
Look, I think that the fact that we are all affected in some way, and before we had to, if I guess the lucky ones are able to do remote working, to really understand the value of what can be done remotely versus what can't be done remotely, but also understanding that if we are going into, say, a phase of much more acceptable remote working practices, what is it that we can do to keep workers and employers connected still, ensuring that productivity is maintained or probably even might actually increase, but making sure that workers' health and mental health and that they still stay connected in a meaningful way to their colleagues, for example, because we know that relationships that are important don't just go across family and friends. Sometimes they are work relationships. So what's really important is for us to understand how we can better change those work practices to actually make sure they don't compromise relationships and meaningful relationships, and that they actually lead to better outcomes as opposed to worse outcomes. So we need those education for employers to, how do you, if you are starting to move into the remote working practices, how do you keep your employees meaningfully connected to your organization, and what those structures are? And really we're trying to kind of work those things out at the moment because really we obviously haven't had I guess this is almost, as I was saying, it's a pandemic that's kind of came out of nowhere, but also it's forcing us to go into these change practices very quickly. So coming out of it, I think we need to kind of have a little bit more thought about how we can balance remote working without compromising the way you feel about other people.
I'm sensing from certainly anecdotal evidence, talking to friends and colleagues and clients that I work with, that some people are hating working from home and crave that social isolation, social interaction, in the office environment, whereas others are loving working from home and discovering that they are so productive. And they're actually dreading the concept of having to return back to their office environment. Is there a disconnect between the work undertaken by researchers in mental health and the findings and recommendations being applied to in the workforce? Like, why do some people just love working on their own and others the other way? What's going on there in our heads?
That's a very good question, and I can only speak to related research, and it may have to do with personality types. And there are people who would crave and who are more reliant on work relationships to actually satisfy some of their social needs. And sometimes it might even have to do with the person's personal circumstance. So if you're living alone, for example, you're more likely to have been reliant on these external social relationships to satisfy those needs. And if you're really removed, and some people also really place high value on face-to-face interactions as opposed to remote, right? Yeah. So, it might have to do with some individual factors going on. There are also factors that are very, very much practical, like absolutely love my job, for example. But it takes me about a good 45 minutes to an hour to travel to work, and I don't live far from work because of traffic reasons. Yep. And I feel like I'm using that time really to work at home and trying to get that balance, and my productivity is higher, for example, because I'm not spending 2 hours in a day driving. I am able to spend more time at home. So it really depends on the person's circumstances as well, whether they relate to their colleagues, whether they are extrovert or introvert, whether they have the capacity to actually invest in those relationships, whether it's at work or use the time to invest it at home. It would be really interesting to see how people actually make the transition. And I think, a lot of research needs to go around how we make a smooth transition, and how do we get employers to be more open to remote working where it actually makes more sense.
How does the academic world intervene in that and get in front of employers and say, hey, this is what our research has told us. And if you haven't noticed it anyway over the last 4 or 5 months or however long this is going to last, then you need to start to make some adjustments to your work practices. How does the academic world get involved in this kind of conversation to make these workplace practice changes?
Look, I've been very, very fortunate and very lucky to be part of a research team that actually is able to reform policies in workplace practices. So I think, academics being hired into these sorts of government agencies, I think the equivalent would be, WorkSafe Victoria here, about implementing how we return to work in a way that in the new COVID environment as well. How do we return to work safely? And it's not just a mental health thing, right? There's all these physical health and all these employer responsibilities that they need to do in order to allow the worker to return to work safely. Really employing academics within these organizations and actually doing good, because getting that actual access to the population and doing good research to be able to implement or design new programs that would actually allow people to maintain or increase their workplace productivity post-COVID in a new working environment. And we suspect as well that some industries that might cease to exist, right? So, it's really important for us to think about all these factors going past this, immediate public health crisis. How do we get back some sense of normality, and how do we function and work, and how do we relate to each other in a post-COVID social environment and work environment? Being able to have that good academic rigorous research in these agencies is quite crucial, and then be able to roll out and implement very quickly. So it's really working hand in hand with them.
It's a fascinating area of study, and we really do appreciate you taking time out of your pretty busy schedule to come onto the podcast today to discuss this. And I think that we may have to get you back at a later date when we do eventually get out of this and find out about get an update, I guess, on your research and evaluating the research you're conducting through this incredibly unique moment in social history. So thank you very much.
Thank you for having me, Stephen.